So in Zimbabwe, we find that breast cancer is number 2 cancer. Our most common cancer is cervical cancer that accounts for nearly a third of the cancers in women. And world over, breast cancer is the most common cancer in all women, so accounting for quite a number of cancer deaths. And what we have found is that 1 in 8 women who reach the age of 85 years of age develop breast cancer, which is quite significant. So the older women get, the more likely they develop breast cancer. And every 3 minutes, a woman is diagnosed with breast cancer, and unfortunately, every 13 minutes, we're losing a woman to breast cancer. So it is the second leading cancer killer of women, and the overall leading killer of women in ages of 40 to 55 years of age, which is an important age group for our women, and we're losing them at that unfortunate age. So what causes breast cancer? We need to be aware that there are factors that we cannot control and there are factors that we can control. So the importance of this is that knowledge of the factors that we cannot control helps us actually to know if we're at risk. Then we can actually go for screening and detect cancer early if it does happen. So by virtue of being a woman, one is at risk. Breast cancer also occurs in men, but less frequently. And the older we get, so age is a major risk factor. As we get older, the risk increases. Having a family history of breast cancer also increases our risk, especially if we have the BRCA BRCA mutation gene, which increases our risk of developing breast cancer to over 90%. This BRCA mutation is a mistake that we're born with within our breast cells that predisposes us to developing breast cancer. Having a personal history, for instance, if you've had breast cancer in the past, your chances are higher. And having breast tissue that is dense also increases one's risk of developing a breast cancer.